So RFK Jr. has been confirmed, which is great. Bad for all the people pushing shots down on our children and others. Bad for them. Bad for the people that want to keep us sick, but great for the people who want to be healthy. So I'm very happy. I think that was one of the key positions, cabinet positions, that I was really watching for. And thankfully, RFK Jr. got through. And I really, really appreciate that. Now, there are going to be people on the left who are going to hate it, but there's also going to be some people on the right who are already making noise about that and saying that RFK Jr. sold out. And now that he got in, he's not as hard on the vaccines as he was. I'm going to get into that, and we're going to talk about that. It's a very good question. So here's the story in Time. RFK Jr. outlines his health secretary priorities, post-confirmation interview. If you take this all the way down, it's Maha time. Love that. It is Maha time. We need to be healthy in America. That's why it's so important that RFK Jr. got in there. So important. And I'm going to get down to where he talks about vaccines. Here it is right here. He says, I'm not going to take away anybody's vaccine, which is fine. You don't want, if adults want to take the vax, they can take it. Okay. The problem is with children. And is he going to deal with the vaccine schedule for kids, which is totally insane? As soon as kids are born, they pop out, and all of a sudden there's all these vaccines that they're supposed to take and are taking. And they haven't even built up their immune systems yet, and it's absolutely insane. So I hope he deals with that in general. Laura Ingraham asked him whether he thought the COVID-19 vaccine was safe. He said, we don't have good data on it, and that is a crime. Well, we do have good data on it. And so what he's saying there, he is now pulling back really from what he was saying before. Again, I'm glad he's in there, but he's going to have a battle with probably President Trump himself, who has never stepped back and said anything negative about the vaccines, because he was the one who was pushing Operation Warp Speed. He was the one who was doing that. So, and at this point, he doesn't feel like he wants to. One thing about President Trump, he doesn't admit making mistakes. He doubles down, which has served him very, very well as president and as a candidate. But when you do, in my opinion, actually do make a mistake, and this one's a huge one, you need to fess up. But he may not be doing that. Maybe he's afraid that they're going to pin the tail on the hunky here, and he's going to get the blame for it, which he may get if he was to open up and say something negative about the vaccines now. But to me, he should at least remain neutral. Why keep pushing something when we know, and RFK Jr. does know himself, that these vaccines have been a major problem in terms of deaths and in terms of injuries. So RFK Jr. asked for these vaccines, the COVID vaccine, to be pulled off the market. I don't know how much I can say anymore. I've been pulled off. For almost 5 years ago, I've been putting out pro-health related common sense information on YouTube. A number of my videos have been pulled, unfortunately. I hope with President Trump in there now, he said that he's going to stop that. And I really hope that he does, even if I'm saying things that may be critical of him or even RFK Jr. We need to have a free exchange of ideas in America. It's about time we've had it. Otherwise, we're living in some kind of a dictatorship if we can't have a free exchange. So I'm hoping and praying that President Trump will follow through and really watch these platforms and make sure that we can have a free exchange of ideas here. So RFK Jr., this is from Yahoo News. RFK Jr. asked the FDA to nix the COVID vaccine during the pandemic. Good. So he has already said he didn't want the vaccine there. He already knew there was an issue. I'm going to show you why we know we have the information here. We have the information on what these shots have done. This is the open VAERS uh, platform, openvaers.com. VAERS is the reporting system for vaccine deaths, injuries, hospitalizations, and anything adverse regarding vaccines. It's been around since 1990, and but we have never had the amount reported that we have now. As soon as COVID-19 came in, the reports on the virus system went crazy. And the OpenVAERS website, openvaers.com, is a way that all the VAERS information, which is just reporting on vaccine adverse conditions, is easy to see. They put it they're taking the information and put it into something that's very easy to look at and very easy to see. This is just, now there's worldwide deaths and injuries, which are much more than double basically. But I'm just going to keep it on US because I'm a United States citizen. President Trump is the United States president. RFK Jr. is the Health and Human Services Director of the United States. This is the information that he's well aware of, and many others are. Look at the deaths here. Look at that. 19,000 deaths, 90,000 plus hospitalizations. And that is just maybe a tip of the iceberg, because really they've done studies on this, and they may be underreported by a factor of, it could be, we may be getting 10% of the actual report of what's actually the deaths and the actual injuries. Probably that's the high level, but it may be as low as 1%, 1 out of 100. So figure if it says 19,000 deaths, then we've probably got at least 190,000. If it says 90,000, it does not if, it says 90,000, over 90,000 hospitalizations, it may be more likely at least 900,000 hospitalizations in the US. And that is way more. The amount of deaths and hospitalizations is more in COVID by far than any of the other vaccines reported in the VAERS system since its inception in 1990. All of the other vaccines put together, the injuries and deaths have not equaled anywhere close to just COVID by itself. Some reports suggesting VAERS continues to experience delays in publishing reports. Additionally, the system has faced criticism for not publishing all legitimate reports received, with some reports allegedly being quote unquote disappeared. Wow. That's a whole nother matter there. So at the bottom here, I'm showing you and telling you that these reports in VAERS of hospitalizations, deaths, adverse situations regarding vaccines are way underreported. Here is, all right, New York Post. This came out October 23rd of last year. So it's fairly recent. The Health and Human Services spent $911 million on COVID vaccine messaging, consistently overstated the virus risk to kids, a damning House report finds. So basically, they have scared parents into making sure that they get their kid vaxxed with the COVID-19 vaccine, even though there's so much evidence that kids have a great immune system. Kids have a fantastic immune system, and the risk to kids of dying of COVID-19 has been almost nil. It's been almost nil. And yet, despite that, they keep pushing that. And even to this day, they are pushing this vaccine onto kids. In short, the FDA used an emergency use authorization, EFA, right, in order to get uh, the vaxes in there in the beginning of the early stages of the pandemic. And usually, when you have a vaccine, you need to have years and years of studies to make sure that this thing is safe. They didn't do that. And maybe you can say, understandably, to some extent, because we had this worldwide situation with all sorts of pressure. And eventually, Trump came out and said he started Operation Warp Speed. So we're going to hurry up and get a vaccine. Trump has been great all through his career as a builder, the skating rink in New York City. He was able to get it done when nobody else could. He's been known, as you can see what he's doing right now in the first 3 weeks or so of his administration, he's known for acting very, very fast. And in most cases, vast majority of cases, it's beautiful. He's able to do great things in a short period of time. Unfortunately, with the vax situation in COVID-19, these shots were pushed out through Operation Warp Speed in a very quick way before the information, before the studies could be done fully to really understand what they were doing to people. And that has resulted in untold amounts of deaths, as I've showed you, and injuries here. Um, RFK Jr. knows that, as I said, and looks to be pulling his punches so far. I hope that he really changes course here. He's in a very tough position. He might have had an understanding or had to have an understanding with Trump and with the senators to even get into this job. If he would have probably come out and said what was really on his mind during his hearings, very likely he never would have gotten the job to begin with. So you can call it what you will. You can call it cowardice, or you can call it maybe him playing the game in order to get in there to hopefully do some good. COVID AP says COVID treatments were not suppressed to okay the vaccine's emergency use. That is not true. In order to get the emergency use authorization for the COVID-19 vax, they had to come out and say there are no viable alternatives out there. So we have to get an emergency use authorization. That's why you need an emergency use, because there's nothing else that can do the job. Okay, it's pretty obvious. At the time, though, we had hydroxychloroquine out there, which Trump started to support. Dr. Vladimir Zelenko, the late, great Dr. Vladimir Zelenko, and I've had videos on the past about him. A lot of them were pulled by the powers that be. He was out there treating people in the Hasidic, I believe it was the Hasidic Jewish community in New York. He was having amazing results with hydroxychloroquine, in addition to azithromycin and zinc. He called it a COVID-19 cocktail, and he actually had studies done. He ended up getting studies done later on. It showed that it worked fantastic, but it had to be early treatment, or it wouldn't work right. And you had to use zinc with it. Zinc was the key to getting the hydroxychloroquine into the body. He called it the bullet shot out of the gun that got it into the body. So certain things you had to do. Then later, the government did studies which purposely did not have people getting treatment early with it, and they did not use the zinc with it to get it in there. So they purposely screwed up the studies in order to make it not work. And that was quite diabolical. They knew what they were doing. Dr. Zelenko has since passed, unfortunately, and he would be rolling in his grave right now if he knew what has been done. They were doing some of this stuff while he was still alive. And here's an article here. Found this, uncoverdc.com. Follow the money. Now this came out February 16, about 4 years ago almost to the day here from what we're talking right now. So this is about a year after COVID came out. This was talked about. They knew this information early on. Follow the money, hydroxychloroquine versus the quote unquote vaccine. All right, so hydroxychloroquine had a 65-year plus safe record It was on the World Health Organization's list of essential medicines for years, sold over the county in many over the counter in many countries, prescribed more often than penicillin. The problem was you could do a dose of this, and Dr. Zelenko talked about this. You could do, I think it was one dose for like about 20 cents or something, compared to what it would cost to do, to use a vax, or even to use something as horrible as remdesivir, which had a horrible track record. Remdesivir had a horrible track record, and yet was used and pushed by people like Fauci and others, even though it was known to do horribly in the studies. So you had people like Neil Cavuto on Fox saying that hydroxychloroquine, quote, will kill you. I cannot stress this enough. This will kill you. Okay, anything will kill you if it's used in a unprescribed manner. Anything will kill you, right? And if you use something in a study and you purposely don't use it correctly, you don't give it to people early, right? You don't give it to people with zinc. You don't give it in the way that's prescribed that Dr. Zelenko talked about in his COVID cocktail that he had so much success with and that he told President Trump about. And President Trump talked about it for a while until maybe people got to him, maybe he got scared, maybe he saw these studies coming in that saying it didn't work, the fraudulent studies, whatever it was, he backed off, unfortunately. And then they got the emergency use authorization for the COVID vaccine, which never should have gotten it because you had hydroxychloroquine in there, the hydroxychloroquine cocktail. You had ivermectin. You had other things. You had Regeneron out there that was, I remember, being used in Florida and other places with great success. There was no reason to have an emergency use authorization for the COVID-19 vaccine, which is still apparently in use today under that same emergency use authorization. And I think they still have to use that authorization because to this day, they don't have the long-term studies which would show that it works. And they're not going to have those studies, it looks like. Based on the VAERS information that I've already showed you, they're not going to have those studies. So this is totally preventable. It's been preventable. And we're almost 4 years going into this. And now with Trump's project, Stargate project, which is going to use AI, and supposedly, according to some of the people involved, they're going to use AI in order to find a mRNA vaccine that's going to be used just for you, so to speak. This has been said by Larry Ellison of Oracle. He's one of the guys that Trump did the press conference with. He also did it with Sam Altman of OpenAI. He was there as well. Even Microsoft is involved in this, which Bill Gates still has a little bit of Microsoft. Of course, he's basically the father of Microsoft, so he's been involved. Larry Ellison has also been for a surveillance state, openly about that. He was a big Obama supporter. These people are trouble. I have another video on this, which I will put in here, which you guys can look at. This whole Project Stargate thing is really, really concerning. So the FDA cautions, this came out pretty early on in 2020, July. It looks like July of 2020. So it was pretty early on in the pandemic. FDA cautions against the use of hydroxychloroquine or chloroquine, which wasn't something that Dr. Zelenko talked about, chloroquine. They purposely messed up the difference between hydroxychloroquine and chloroquine, which is something that's like used in cleaning fish tanks. And I think they purposely wanted people to go out and use the wrong substance so people would have a bad reaction or in their mind, probably hopefully kill somebody. And so they had people reportedly drinking fish tank cleaner, chloroquine that was used in cleaning fish tanks and having all sorts of bad adverse reactions with it. It's so they manipulate the public. They manipulate us constantly with information that's a lot of times purposely wrong. It's unbelievable. All right. So later, they came out with a study. The Center for Tropical Medicine and Global Health put this out and said hydroxychloroquine provides moderate COVID-19 prevention. Okay, so that was late September of 2024. So after they trashed it with study after study saying hydroxychloroquine doesn't work, it can kill you, stay away from it, purposely messing up some of these studies. Now they come out later when it's to cover their butts when the information started kind of getting out there that hydroxychloroquine was fine. Then they come out in September of 2024 and say, "Oh no, it's okay now." Well, now that we have possibly another pandemic coming forward, now they're changing their tune back again and talking about a retracted study. So this just came out the end of last year. So in December, study retracted years after it set off an infamous COVID-19 treatment scandal. So there was a study that was promoted by a great researcher, a virologist named Didier Raoult. I hope I'm not pronouncing his name wrong. It's French, and I'm not great in French. But this guy was touted as being this amazing virologist. He was world renowned all over the place. But when he came out and touted hydroxychloroquine, they went after him. And now he's like this discredited guy. He doesn't know what he's talking about. And this study that he promoted has now been retracted. Here's an article that came out, American Thinker. This came out in 2021, a little over a year after the pandemic started. Why are the media ignoring data showing a massive COVID-19 vax death spike? The death spike that I showed you earlier on Open VARs, they already saw this going on. It was known early on. So honestly, when RFK Jr. talks about not having the information yet, we've had it for a long time. He knew it. He spoke out about this a long time ago. The question is going to be, is he going to stand up and tell the truth here, which could get him at odds with President Trump and some of the people who are in President Trump's ear about the vax. So again, it says this story here on American Thinker. If these were any other vaccines, they would already be off the market. And they were saying this over just a year after they're saying this in 2021. This was May 17, 2021 when this came off. That's how long ago they were saying this vaccine should have been off the market. And even at that time, they're saying it should have been pulled a long time ago with all the deaths and injuries reported from VARs. Look at this graph here. This is interesting. These are deaths in the VAERS system since 1990. You go along and show low number of deaths from vaccines all the way to 2020, and then spike time goes from 0 to 2000. And again, remember, I'm talking about potentially being only 10% or maybe as low as 1% of the actual deaths and injuries that VAERS is reporting. This was a red flag then when they reported it in 2021. And way before that, it's been a red flag issue for almost 5 years. When are we going to get the truth here? Here was the Zelenko protocol, so we know it was out there. It's very hard to find it anymore. Zelenko protocols, COVID-19 prophylaxis and treatment. So Dr. Zelenko put out a prophylaxis, meaning what you can take to keep from getting sick. And then if you get sick, they call it the treatment. and he has different protocols for that. And he put those out a long time ago. This man's work should be, and I'm not discounting also ivermectin, which the media went after and called it horse paste, right? And they said you can give it to your horse, ha 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 ha. I mean, the government was literally putting this out. Maybe okay to give your horse, but not to people. They've known ivermectin has been used safely for decades as well. But they have purposely trashed hydroxychloroquine and the protocol put out by Dr. Zelenko, and they have trashed ivermectin on purpose in order to get their emergency use authorization the FDA put out for COVID-19 and their vaccine. They've had trouble after that because thankfully there's X and there's a new media out there that is getting the information out there. But if we had to rely on the same old media that we've always relied on, we'd still be in the dark ages. So thankfully, I don't think JFK Jr., RFK Jr. would have gotten out there and even been confirmed if it wasn't for new media. And the same thing for a lot of the people. I don't think Trump even would have got elected if it wasn't for new media. I think that's pretty clear. So thank God for new media. But new media has got to propel us to the next level here. Why, even after new media, are we still having these shots out there? So maybe we can put enough pressure on Trump to do something, maybe on RFK Jr. I'm out there. There's other people out there that are not going to give up. And until we have truly make America healthy again. We have right now, RFK Jr. is in there. We have the slogan. We have some great things. President Trump is doing some amazing things right now. But if we don't get a handle on this, we're going to have another which COVID come back. There's going to be something else. Also, I was watching Glenn Beck last night, and he just put out a video on his channel, which is showing the whole background of how COVID came to be, how the lab leak situation happened, how Fauci was lying, and how we weren't even supposed to be testing this stuff. Gain of function. Okay, I talked about this stuff and put out stuff about this stuff over 4 years ago. Gain of function research. This stuff was supposed to be illegal. It was made illegal even under the Obama administration in the United States, way back in, what was that, 2016 or whatever that was. It was illegal to be messing with this stuff and testing gain of function research. And all gain of function research is taking a virus or something that's transmissible to human beings and making it more easily transmissible. So they were playing around with viruses from bats and different animals and things in a laboratory. They were doing that in the United States and trying to make this stuff more transmissible to human beings. And they said, no. At some point, they had a big outcry. You can't do this anymore. And Fauci was at the helm of this thing. And he's been known about from way back when. We could do a whole nother thing, and other people have done that on the AIDS situation, AZT that he pushed. This guy has been responsible for untold deaths and injuries for decades. I mean, the guy literally should have been in jail a long time ago. And frankly, Trump should have, and people working with Trump should have known about this guy. He was allowed to parade himself day after day, even under Trump, and get out there and parade himself along with Birx, the scarf lady. Day after day, they were allowed to put out crap information to the public. So we knew about gain of function research. We couldn't do it legally in the United States anymore, and they offshored it to the Wuhan lab. And it looks like Ukraine as well. Fauci and these other people have not been stopped yet. So the gain of function research is being done all over the place now. It's not just Wuhan, but it's being done all over the world, and it's still in use. So we're going to have, it looks like, some other pandemic that's going to come on, and there's going to be a push for mRNA vaxes. And I don't know what Trump is going to say about it. Is he going to push them? I don't think he'll make it mandatory, but this stuff should be, somebody should be out there, the president and RFK Jr. should be out there saying, we've got plenty of information now on this stuff. It needs to stop. So, bottom line, are we going to, now that we have Trump in place, he's a lame duck now. He has nothing to lose. He can do everything that he's wanted to do, and he's doing some amazing things so far. I thank God for the things that are being done right now in the United States. What they're doing with AI needs to be looked into. Again, look at my video regarding the Project Stargate. It's very, very concerning what's going on with that. Rubber meets the road here, folks. You got RFK Jr. in there. You've got all these people in there. And the question is he going to be truthful? Is he going to speak up where it's really necessary? So make America healthy again. Does he mean it? Is he going to stand up? Maybe you have to stand up to Trump himself. Maybe Trump needs to get educated. Whatever the case may be, the rubber needs to meet the road here, folks. We're at the point. What are we going to do about it? I hope what we're going to do about it is stand up and put an end to the nonsense and really, truly make America healthy again. Thanks so much.